I'm going to explain the dental chart that we use in SAM2 and in anesthesia at Argosy. This may not be the exact chart that you see out in practice, but some chart is typically used in most clinics, and the things that you're charting on this form would be recorded somewhere on that chart, if not exactly like this chart. So the first thing you want to do on your dental chart is fill in the top part, and this can actually be filled in on a quick exam of the animal. For instance, in anesthesia, you can fill this in the day before or what have you, before you do the lab. That's basically just the patient information, the bite. It says tooth occlusion. What we mean by that is bite. So is it a scissor bite? Is it a level bite, prognathic or brachygnathic? And chief complaint is why we're doing the dental. So in most cases, that's going to be tartar and gingivitis. The front of the form, which is this sheet, is what you find when you're doing the oral exam and the dental. The back of the sheet, which is what this sheet is what you do about what you find. So you don't have to repeat any findings on this diagram. This would pertain to extractions, x-rays, things like that. So for the most part here in class, especially in anesthesia lab, we don't do extractions generally, and we do some x-rays, so you wouldn't have a whole lot written on the back of this. So let's go back to the front of the form. The next thing that you're going to do when your patient's under anesthesia for a dental is to do the oral exam. We always look at the soft tissues of the mouth before we actually start probing or looking at the actual teeth. So the oral exam portion is right over here, and it lists things like buccal mucosa, tongue, palate, everything like that. So you're looking very carefully for any abnormalities, ulcers, any other type of lesion, mass, lacerations, anything like that. We want to look under the tongue, we want to look at the tonsils. You're going to circle either N for normal or A for abnormal, and if it is abnormal, you're going to make some notes either right over here off to the side or down here if it's something that you need more room for. Once we've done the oral exam, then you can start looking at the teeth, looking for abnormalities such as missing teeth, fractured teeth, things like that. Those things will always have a code over here. And it's usually an abbreviation, and then you're going to put that abbreviation over here on the mouth diagram. Remember that the mouth diagram is oriented as if the dog was looking out of the page at you. So this side is going to be the dog's right, and this side would be the dog's left. Once we've done that part of the exam, then we're going to start probing. And for probing, you've learned about it in lecture, but just a quick reminder, every tooth gets probed in 6 places. So for instance, on this canine, when our dog is in right lateral recumbency, we're going to probe on the mesial aspect, meaning towards the midline, the buccal aspect, meaning in the center of the tooth, and on the distal aspect, meaning towards the back of the tooth. And we're talking about each individual tooth when we use those terms. So that's 3 spots on every tooth on this buccal surface. Then we would do this buccal surface. Then we would do the palatal surface of the side that's facing us. And then we would do, the lingual surface. Then we would do the palatal surface up here of that arcade. So the canine, the corresponding upper canine, would get probed again mesially, palatally, and distally. Then we flip our dog over into left lateral recumbency and we do the other surfaces, therefore eventually doing 6 surfaces on all teeth. To record those dental or those pocket depths, now we go back to this part of the chart where the little boxes are. And again, the diagram is set up as if the dog was looking out of the page at you, with this dark center line being the midline. So for instance, if we had a 4 millimeter pocket on the mesial surface of one of the canines, and let's just say 104, mesial would be to this side of the box because it's closest to the midline. If the pocket was on the distal surface, you would put the number over here in the box because then it's away from the midline. And then the middle surface or the buccal surface would go in the middle of the box. So when you're writing your numbers, you need to make sure that you leave room for 3 numbers so that it's very easy to see where that number is placed. You may only put 1 number in the box and you have to be able to tell where is that number. Is it to the front, is it to the middle, or is it to the back of the box? Now when we switch sides, so let's go to the other canine, 204, mesial now is over here. So it's on the opposite side of the box that it was on the other side, but it's still closest to the midline. Again, distal would now be over here, away from the midline. The pocket depths, you're again always going to leave room for 3. When we get to frication and mobility, you only have one number. It's a grade 1, grade 2, or grade 3 mobility or frication. So the number can just go in the box. It doesn't matter where the number goes. So those numbers are going to get filled in as you go through the whole exam on this chart. Again, numbers only in the boxes. None of these symbols will go in the boxes. These symbols go over here. The next thing that we oftentimes forget to do on this form is to grade the stage of periodontal disease. And a lot of our patients, almost all of our patients, have mild gingivitis, and that is PD1 or periodontal disease stage 1. In order to really stage it, you do need to take x-rays to estimate the bone loss. So if we don't have x-rays, we simply go by whether or not we have pocket depths, which would indicate bone loss, or whether it's just gingivitis. If any one tooth has, let's say, stage 3, then the whole mouth is graded as stage 3. So the stage of periodontal disease is really based on the worst tooth in the mouth, essentially. Nothing that you put on this form needs to be transferred to the back. So from here, let's look at the example. And on your example, you have, the first thing that you have is a 5mm pocket on the buccal surface, the mesial aspect of 104. So on this form, our number 5 would go right here in the box on the mesial surface, so towards the midline, and that's where we have the little 5 written in there. The second example is 7mm pocket on the palatal surface, mesial, buccal, and distal aspect of 209. So that's all 3 locations on that tooth. So that's over here, and we put 3 number 7s in there to indicate that the pocket depth of 7 was on the mesial, the palatal, and the distal surface. The fracture, let's jump down to where it says fracture, fractured crown of 409. So we're going to come over here, and here we have CRF. If you look over here, we have different grades of fractures. So we have fracture first, and then we have different kinds, and it's a CRF, so that would be circled here as well, and then the code is just put near the corresponding tooth on the diagram. Gingival recession also goes on here, and recession is done just like the pocket depths. So again, leave 3 spaces, and we're going to put that recession number wherever the location is on the tooth. And again, you may have 3 numbers in the box, you may only have 1 number in the box, so make sure it's accurate where you're putting that number. Hopefully this helps explain the dental charting, and you can refer to this anytime you need a little bit more help with this charting.